Care Queen Brenda here. How can a person with dementia end their life? For those with a strong family history of dementia, a condition that leads to dementia, or those simply looking to avoid living with dementia in their final years, we'll share some practical suggestions from our years of experience at the bedside to have your wishes honored. When discussing the possibility of dementia, we often hear people say, "Just take me out in the woods and leave me." While they may truly feel and mean this in the moment, of course, that's not something anyone can actually do, not legally or ethically. But what is really being expressed is the deep fear of living with dementia. I've been a hospice nurse the entire time my girls were growing up. And one day while driving my 15-year-old, I was going on about something, blah, 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 while she was stuck in the car with me. And finally she said, "Mom, if you don't stop harping on me, I'm going to let you live when you have dementia." Well, my first reaction was, of course, to laugh because it really was funny, but it really made me think. First, wow, she has been listening. And secondly, there's no real legal or ethical system in place to allow a person with a form of dementia to hasten their death. The fact is, people with diagnosis of dementia do not legally qualify for MAID, which is medical assistance in dying, or VSED, voluntary stopping of eating and drinking, with the intent of hastening one's death. This is a complex topic, and I won't cover everything in detail here. We've included a link in the description below to an article that provides a more in-depth explanation. The most powerful tool is without a doubt communication, both verbal and written. Engaging in these difficult, uncomfortable, and in-depth conversations multiple times with those in your life helps bring clarity for both you and them. It needs to be a deeper conversation than simply saying, "I just don't want to live like that." Most people shy away from these discussions. It's a common cultural norm. However, if you truly want to have say in the final stages of your life and are not mentally competent to speak for yourself when the time comes, you simply have to take the courageous step of addressing it with the intention of having an advance directive. It's imperative, and we suggest going a step further and writing a letter or a document stating clearly what you want and don't want if you are at the stage of dementia that you can no longer clearly make decisions for yourself. This letter should be addressed to your family, your designated medical POA, the person who's responsible for making medical decisions on your behalf if you're unable, your primary health care provider, and to any current or future caregivers, even if you don't know them yet. You can also choose to have it notarized. So what should be in this letter, which is an extension of your advance directive? A detailed description of your wishes regarding treatment options and how you want food and fluid offered or not offered. This should go farther than the checkboxes in your advance directive. We remind people all the time that they have the option and legal right to decline diagnostics, treatments, procedures, and medications of any kind. Just because we can treat or fix something doesn't mean we should. It depends on what the goals of care are. That's what people need to define for themselves and have clearly communicated to anyone involved in their care. Examples of this are treating or not treating urinary tract infections, pneumonias, or a broken hip due to a fall. These are common issues that arise as people decline toward end of their life, with or without dementia, and they don't have to be treated. Keeping in mind, hospice can manage symptoms of these issues and keep them comfortable. A person facing dementia could document in their advance directive what they wish to receive on their surrogate decision maker, or their surrogate could make a request that they receive only comfort feeding only. Comfort eating or feeding is just what it is. Food should only be a source of comfort and enjoyment. Only offer foods and fluids that people truly are showing interest in. There is no need to consider nutritional value at this time, and any sign of disinterest verbally and non-verbally should be honored. But this is really hard for families and caregivers to do this. It's common in the same conversation for families to acknowledge their loved one did not want to live with dementia, but they're also concerned that they haven't gotten in enough water or protein. That's because we want to be good advocates and feel like we are doing the right thing. This is why it's important to give the people in your life very clear communication about your wishes. They have to feel good and have peace about not treating things as they arise and feel good about offering comfort eating only. My daughters are actually tired of hearing about this from me. As soon as I bring it up, they say, yeah, Mom, we know all you want is a little wine and maybe some cheese. So this is clearly a complex issue. Feel free to ask us questions on our blog, The Hospice Care Plan, and get a copy of our booklet, The Hospice Care Plan, in the link below. It gives you hands-on instructions how to safely and effectively care for the hospice patient.